Hi, everyone. Welcome back to the Blossoming Together podcast. Today, Kirsten and I will be speaking on how to conduct parent intake questions and some of the interview questions that are associated with it. So do you want to jump into the first objective?
Yes, our first objective today is demonstrate proficiency in establishing rapport and gathering comprehensive client information during intake interviews.
And then the second objective is demonstrate proficiency in using information gathered during the intake interview to develop caregiver training goals. All right, so we were kind of talking about when we start doing a parent intake, we want to look at it or think of it as the stage that you're setting up for the parents, right?
Yeah, like the purpose of it.
Yeah, so we were saying maybe start thinking of it as like a good Netflix series.
Yeah.
Like the first episode has to be really good to get you hooked on it.
It's like Bridgerton.
I know, I love Bridgerton.
That first episode, it gets you.
All right, so think about that when you're starting to go into it. So the first part, like it's crucial, right? That intake, like if they come out of that intake process feeling uneasy, it's not going to be good.
It's not, you're building your rapport. This is where you're really letting the parent know who you are as a BCBA and who they're going to be working with for the next few years, theoretically, with their child. So having this rapport and like momentum at the start is really important.
So it's important to kind of just set aside maybe 15 to 30 minutes to do this parent intake interview and then go from there.
I usually do this at the beginning. I don't know when you do it.
I usually do it at the beginning, too.
Of the initial assessment. So, like, before I do the initial assessment, I'll do the, like, parent-caregiver interview.
That's perfect. So, what are some of the benefits of the intake interview?
So, we already talked about we want to establish rapport. Establishing rapport and trust with the family from the start is really, really beneficial and important. And we also gather crucial information during this time. So a lot of this information will be used to guide your goals. Like your assessment with the learner is going to give you goals for them. But when you do this like interview, you're going to get information that you know is valuable to the family and where they want the goals to go.
And sometimes I feel like, I mean, if you don't do an interview, like you're not going to know what you're to expect going in assessing the client either.
And like what the priorities are going to be. And
I feel like at least in the intake, if I find out like this client has a hard time with like maybe loud noises, I know like go into a different room that might not be as noisy, or if they have a hard time around peers, I might need to do that intake, like the assessment in a different room around like maybe just us right now.
You're getting to know the learner from the parent like perspective, which is really helpful. And then you also get to know, like another really big benefit is like you get to know where the family wants to go with their therapy. What are their expectations for ABA therapy? What are their expectations for their goals? And then you get to set up expectations for them so that they know how to go about their therapy as well on their end.
True.
And I kind of wanted to go back. You mentioned at the beginning, like the importance of establishing rapport and kind of like this is the start of their ABA process. When they come to us for this intake, they have already been through like a lot of these questions they've heard from different people already. Like when they're doing the like their assessment to get like their diagnostic evaluation. So they've gotten a lot of these questions. So they're coming in and they're hearing the questions from you probably for like the third or fourth time, and it's getting like irritating for them. So go in really compassionately, and even at the start be like, I know
you've heard it a million times
You've
already.
heard all these questions a million times, but as your BCBA, I want to know directly from you what your goals are. I don't want any miscommunication through reading reports and stuff like that.
I really like that. That's a good point.
Yeah.
So when you meet with the parents, it can be helpful to kind of also in this section or during the intake interview, kind of share what the assessment process is going to look like for that learner and that day. So sometimes they're like, okay, sometimes they don't even know how long it might take. So, okay, hey, my plan is I'm going to do this interview with you, and then I'm going to ask maybe that you leave. Are you comfortable? Even asking, like, are you comfortable with that? Because imagine someone told you, like, hey, I just met you. I'm going to ask you, like, 2 or 3 questions, and then you can leave. I'm going to hang out with your kid.
I'd be like, no, I'm going to stay with Athena.
Yeah, I want to stay. So you can ask them if they're comfortable with that, if they're not comfortable with that. But you can also share, like, I would want you to leave so I can just see if, like, how the learner responds without you there.
The value of, like, not having the parent there.
Yeah. And then this is also a good time to ask any concerns that they may have. I've had so many parents like, well, I don't want to leave yet because, like, what if he needs to go to the bathroom?
Right.
And I feel like a lot of information comes out, like, why don't they want to leave their kiddo, like,
Yeah.
you know, what's
They
happening.
might have like a history of,
Yeah.
you know, abuse in their end
Right.
or, you know.
Or the child may have had a traumatic experience when leaving parents before.
Yeah.
And that's like a moment it comes out in. Versus if you just meet the parents and you wait to do the intake interview or you just have them fill out a questionnaire. I mean, sometimes the questionnaires, like, I look at them, and parents don't. They're done at that point.
No.
They're like, nothing.
It's like 30 questions and they're like, all right, yes, no. Like
No.
they're just like skimming through it.
So I feel like a lot comes out of that one-to-one like interaction.
Yeah, that like personal interaction. I want to stop really quick for our first code word for our CEUs. Your code word is going to be rapport. So we kind of wanted to talk about the importance of like personalizing the approach with the intake process. So I don't know what you kind of, if you have any ideas with this to start out.
So usually what I'll do is instead of like a formal Q&A, I try to like have a conversation. What I do like have a set of questions that I'm going to ask.
Yeah, I always have.
Yeah, I
them
have a
prepped.
set like questions, but I don't want to go in there and be like, what, like, imagine this, hey, what's your favorite color? Like, imagine you on a first date and like, this is like how it's going. Hey, what's your favorite color?
They're jotting it down.
Yeah, jotting it down. Oh, do you like pickles?
No.
Oh, okay.
Yeah.
Stuff like
It's, like, so
all
uncomfortable,
awkward, and you
yeah.
don't know, like, I wouldn't want to open up to someone that was asking me questions like that
No.
either.
So you want to give them the space to have like open-ended conversation. So the questions you provide, they really need to be open-ended.
Yeah. And, you know, and sometimes I know with some families, like, open-ended is way too much. Then you
Yeah.
can always, like, gear it back. And you'll know, like, for parent training, this is someone I might need to do XYZ with.
Yeah. Like
know?
you might have to modify the way that you approach because
Yeah.
like they might not know how to answer. Even if it's open-ended, they don't know where to go with the conversation or they might not understand what you're asking. So
Exactly.
making sure to clarify.
What are some other... Okay, so now we're kind of, like, jumping to, like, how you prep for this interview, right? What are some things you do?
So number one, I'm going to go through all of like the prior records and referrals, like all of the documents. So I'm going to look at their diagnostic interview, and then we have like an intake team who does like a phone interview. So I'm going to go through their phone interview as well, just getting to know the client first. And then I want to make sure I have a welcoming and non-judgmental environment for them to come into. So this might look like at our center, we have meeting rooms. So I'm going to choose the meeting room that's more cozy. We have meeting room 2
Yeah.
that has a big cozy couch. And
And
it
it has
a nice
more toy,
table.
and you can bring some toys in just
Yeah.
to make the learner comfortable, like, coming into the space as
Yeah,
well.
I want it to look like a very comfortable play space. I don't want it to look like, I don't know.
A desk.
A desk.
A
like-
desk where the parents sit, or the caregiver sit on one side and we sit on another side.
Yeah, like where it's very formal. Like I just want it to be really comfortable for that parent.
Yeah. And then also when you're there, I feel like
yeah.
sometimes the parent or the caregiver feels really uncomfortable because they're like, well, like the learner's there with them usually, and they're running around. So even reminding them, like, that's okay. Like, that's why I have all these things here for them. And we can chat while he plays.
Feel free to
Or
play
they
with feel free to play with the child. We can take turns playing as we talk about these things.
Because I feel really awkward when I go places and I have my daughter. I'm like, well, I don't know what to do with her.
I had to take her to therapy the other day and she's like running around like the room and I'm like corralling her.
Yeah.
So I'm like, how do these parents feel when we're sitting and trying to like, it almost feels like interrogate them
Yeah.
while they're trying to like run around with the kid.
So even like offering, you like what you said, like offering, like, well, why don't we take turns? I'll start playing and you can like tell me how they like to play,
Yeah.
Stuff of that sort
Going
as
through
well.
it. Another important thing that I do to prep is like we kind of talked about, we don't want it to feel like an interrogation, like we're just asking and asking, but we do want to have an outline of making sure we have all the information that we want to gather from the interview. So I have like a document that has all the different sections and then it has like different questions that I would want to ask or like how to ask them if I like forget on the moment.
I remember the first time I did a parent intake, like I was like, what the hell do I ask like these parents? So I was like on Teachers Pay Teachers, like looking up everyone's like tools, and people have them. There's so many online.
There
but
are.
It's so overwhelming.
And it's like everyone has a different style of the way that they want to run theirs. So I got one off like I think it was Google and I was like, so I took it with me. I was like, wait, this isn't getting any of the information I want.
And
it
I
was in a
remember it
different
was like
way.
it was so weird. That's what I did. I used it and I was like, well, and it felt like really formal and awkward. And I'm pretty sure the parent was like, what the heck?
And I didn't like this I don't know if we're going to talk about this later on, but the structure, the layout, like when they had different questions on the form, it was like talking about behaviors right out the gate. And I'm like, oh my gosh,
They just met me.
I need to establish some rapport before I ask about like the most difficult things in this parent's life.
Right. And then they might not even feel comfortable telling you yet.
Right.
You know, stuff of that sort.
Yeah. So create a document for yourself or like look up one that is going to have all the information that you need to gather during this interview. And then we kind of talked a little bit about like create the warm environment, but arrange comfortable and private setting. So when you are doing this intake, you don't want to do it up in like a big community office. You want to make sure that the room and space you have is private so that they feel comfortable sharing if it's like more vulnerable of a topic.
Especially like what if other parents are walking by and you decided, hey, let's just do it in the lobby because that's the only space I got. But imagine like this family has to share all their vulnerabilities with you. Like, you know, I'm struggling with this at home. No one wants to admit. I wouldn't want to admit that.
It's hard. Space. And they're, like you said, they're brand new to us. So it's already going to be difficult for them to be vulnerable. So if there's like many people listening, it's not going to happen.
So we kind of touched base on when we were looking up like tools to help us in our intake process. We were just finding these like really dry questions. So we wanted to help everyone and kind of how you can ask it in a more conversational way.
We want to provide you some questions to put on your little intake form that you're going to create for yourself.
And just remember, like, don't go word for word on this.
No.
You know, you'll find the questions that are most helpful to you. Start creating like a document with all the good questions and use that going forward.
Or even just like open-ended bullets. And then you're like, you know how you speak and can present the questions in your speaking tone. Don't mimic it just the same way that we would say it.
All right, let's go for it. So I'm going to start with some questions maybe related to like the developmental history of the child. So what you could say is, let's start by talking about your child's developmental milestones. Could you share some of the milestones that they've reached and if there were any concerns along the way? I know a lot of times when you read this, like just on the chat, like the intake form, it's like, did child reach milestones?
And then honestly, like prior to becoming a parent, I was like, well, what milestones? So like as a parent, if I were asked that, I'd be like, well, what do you want to know? Do you want to know they're crawling? Do you want to know like this? They're speaking.
So something you could do then is like going like, oh, and if they look at you with a blank face, like if you see the blank deer lights, be like, well, like, I mean,
and
guide them like, oh, are they speaking yet? How are they able to communicate with you? Are they going to like bathrooms?
When did they start to babble to you?
Like those stuff of that nature. Another one is, has your child been diagnosed with any other medical conditions that we should know about? And how have these conditions impacted their daily life and your daily living?
I want to note when we're asking these questions that we're providing, because we're providing you questions that have like multiple parts. Don't ask them all the parts at one time. So break it down. So ask them that first question, let them answer a little bit.
And then take the other ones as the following one. I feel like the first time I didn't even ask, like the first time I did a parent intake, I was like, I don't need to ask that question.
Like skip over it.
Yeah, but it's very important to know, you know, are you confident in like these other diagnoses?
Yeah, and I think that we talked a little bit about it when we did our toileting episode and our parent training. A lot of these other diagnoses are going to impact where you go with how you like prompt the child or where your goals go. Like, you need to know those other diagnoses.
Or like even learn, like say this client had like extreme anxiety. Like how you would approach like your assessment or how you're going to approach therapy going forward is really important.
You need to know that it's really challenging for them. Another question that we want you guys to know is, could you tell us about your experience with previous interventions or therapies, if they've ever been in any other therapy, and what worked well and what didn't? This parent is going to know their child better than anybody else, so they're going to be able to tell you what works best for them.
And
Trust
then,
the parent.
And then if they share, like, oh, our client or our learner attended, like, speech therapy, you can ask, like, where they went. Are they still attending? How many hours do they go?
Do they intend to keep up with this therapy when they start?
The intent to keep up one is such a good question because I feel like it gets overlooked. And then you think, oh, you're going to come here.
Right. And you never know. And then at that point, it's good to be like, okay, would you be willing to allow us to collaborate with that other professional? Because it's really important to us.
Yeah. And making sure you get all that stuff like signed there, right there and then. So
the ROI.
ROI, get it signed so you can like start doing what you need to do.
Yeah. The next section after like you get through the developmental history is we want you guys to kind of go towards the behaviors and like their main concerns. So the first question with this could be, what are the behaviors you're most concerned about with your child? So they might have a lot of concerns, but what is most imperative to them at this time? And then follow up with, can you give us examples of these behaviors and the situations when they tend to occur? Can you explain why this is so important?
This kind of helps you start to figure out what the function of that behavior might be be in the moment. And then you can take this later and develop some parent training goals later on.
You can create your own like ABC data from it, honestly.
And, you know, it's just kind of giving you a little insight into what to expect and what this family might need going forward is where I'm really going with it. And then also then asking them, like, how do you respond in that situation is a really good question, too. Another follow-up that you could ask. Any other thoughts about, like, why you like to ask it?
No, I think that hits it on the head. It's like really identifying that function.
And, like, you know, not to say like this is going to be clear. Like, it's not always like a clear, you don't always have a clear function.
No, but it gives you an idea of where your hypothesis, like based on ABC data that you collect, or it could even show you like, why does it seem so different at home than what I'm seeing here at the center?
Because, and honestly, sometimes also remembering like just, you know, the parents are going to share with you like, my child does act like all of these behaviors, but when you're doing the assessment, you might not see any of them until way later on.
Exactly.
And they may have mentioned like it's when they give them a few tasks to do.
Yeah.
You know, versus during it might be a fun time for them. They're at a new place
playing with all
especially
the toys.
Like here, like we're playing with them on the floor. It doesn't always feel like work.
And even the first 2 weeks are like, especially if they have multiple technicians, it's all pairing.
Yeah.
So it's a lot of play based. We're still targeting like a few things, but it's mostly pairing. So you're not going to get to those difficult like skill acquisition.
Or it might be the opposite where we see behaviors like later or during the day that parents didn't mention.
Yeah.
So we're trying to remember, oh, like they told me that maybe like these didn't happen, but then going back and be like at the end, maybe like, I noticed like this happened.
Yeah.
Has this ever happened to you? And then they might say no.
Yeah.
And then you'd be like, okay, good to know.
Yeah. So it gives you a really good basis like before you're starting your behavior plans and everything.
Another question I like to ask is, how does your child typically express their needs and wants? So how are they able to communicate with you? How do you know like what to give them, what they want in the moment? And the answer is always a big range, I feel like here, you know.
Yeah.
Sometimes we have like, I just guess.
And sometimes parents will even be like, well, they don't communicate their wants and needs at all. So then that's
the
where
follow-up question. Like, well, how do you know? Like, what are you doing?
Well, yeah, because they might not realize that the child guiding them to something is actually a form of communication to like indicate what they want. They might think that it's only like verbal communication. So like once they answer and they're like, well, they don't communicate, like guiding them again.
Yeah.
What other follow-up questions do you have for this?
Sometimes I'll be like, well, like you said, I'll be like, do you guide them to what they want? Are they pointing? Sometimes, because I do feel like a lot of parents are like, they're looking for that verbal language, so they're stuck on that. But just explaining to them like what it really means.
Yeah.
And then also, how like do you face any challenges trying to figure out their needs and their wants? Because you know maybe they don't know that. You know maybe at speech therapy they've been signing more, but parents don't know what more means. They'll just say like, he starts doing this, and then I just give him something.
Or even he's signing more, but they're like, what more do you want?
Yeah.
Like it's overgeneralized.
Asking them, like, do they feel comfortable? Do they understand always? Or are they struggling with this at home?
Yeah, I think that's a good point. Another section that we want to talk about with like where your questions could go is next would be family dynamics and environment. So with this, it's so important to know like what the family.
Who's at home, right?
Yeah, what does their household look like? So a start off question is, can you describe your family structure? Who's a part of your kiddo's life? And this might not be like necessarily living in the home, but like if
how often they see grandparents.
Yeah, do the grandparents often babysit? What about your sister or brother, like aunts and uncles?
Yeah.
You know?
And I think about our own lives. We see so many people, like our child sees so many people on a daily basis. Like they don't live with us though.
No, but I even think about like the not the caregiver, but the daycare people. Like my daycare instructor sees my daughter more often in the day than I do.
Yeah.
So they're an important like caregiver for the child.
Right. And also if maybe say they're going to daycare and they're going to transition out to start maybe therapy.
Yeah.
Like being ready for that. Like they might struggle with that a little bit. Knowing that.
Like knowing those different like variables that are going to impact like where you're going with it. And also when we're asking these questions, I want to note this isn't the problem solving time.
No.
So don't
give suggestions, which is really that's so hard.
It is.
Because you're like, well, have you tried this? Can you do this? But
this is the time to just like let it be and let them answer. Be like, thank you for sharing that with me, and then moving on.
Yeah.
Have like comfortability with yourself and moving on to the next domain.
Another thing I like to try to figure out in this situation is like the names of the people that are, you know, in their lives. So if they have grandpa and grandpa, does the client call them
what
grandpa
do they
and grandpa?
Go by?
Yeah, what do they go by? Siblings, what are their ages? Because you'll be like, oh, they have siblings, younger, older. How do they interact?
That's my number one. How are they interacting? Do they interact daily?
Yeah, stuff of that sort.
Yeah.
Or like, are they playing with their siblings is a really good one. How do siblings play with like the learner?
Yeah.
Even asking like, has siblings shared like any thoughts and feelings about like
Do they understand the diagnosis?
stuff of that sort? Because you can always help them get connected to someone that can help them as well.
Exactly. Like we're not providing therapy to the other child, but we know we have a lot of resources on our end.
And then another question is, are there any cultural or religious backgrounds we should know about? Are you of a certain faith? Are there certain cultural practices you follow that we should know about?
Yeah.
Because we want to respect everyone's like wishes.
Yeah.
We don't want to go in like accidentally like
not being aware
of something.
So, and I kind of want to like touch on this. I had a learner that I took on, and I didn't do this kids intake. Like it was a case that it was like kind of handed off to me, and we were targeting eating rice. And
was it like left hand, right hand?
No. It was a family that they were learning to feed themselves. And we were I was in parent meetings often, and they're like, we can't get him to feed themselves. And we're like, what's the barrier? Why isn't it working? And it turns out that I didn't realize, like, as the case came to me, that they don't use utensils at home. They just do hand feeding.
Yeah.
So at home, they're making like rice balls and hand feeding.
Like this.
Yes. Like with
even this task. Like, it's different.
But we're feeding the child with a spoon.
Yeah.
So there was like such a miscommunication. So you really need to understand like the like cultural variables that are going to impact what you're teaching the learner.
And even if they are from you might not know every single thing about a culture. So once you find out, like, okay, they're of this background, you can go do some research.
And even asking them.
Like, hey, like, is there anything like we should avoid at the center?
Yeah.
Stuff of that sort. Or then like what holidays are coming up for them as well. So you can always touch base on like, hey, hey, Eid is around the corner and that's not a holiday. Like everyone, like, what are you guys doing?
Yeah. And it's like a connecting point. It shows them that you value them like as their culture and who they are. And
it's really important.
It is.
I think that's a really good one.
I agree.
All right. I had a question for you.
Okay.
So have you ever been like in an intake and like the parents just like, or the caregivers aren't agreeing on the answer?
Yes.
So like, how do you handle that?
Oh my gosh. It's really tricky when like they just don't completely agree. So what I kind of do is I'm like, okay, wait, let me hear from dad first. What is happening with you in this situation? And I jot down what dad says. And then I'm like, okay, mom, what's going on? What is it? What is different about this for you? So then they give me both of their answers. And then I kind of try and talk about like, what about the situation might be different? Because honestly, there are two different caregivers. They're going to be handling situations differently.
And then I feel like, do you look at it and be like, I might need to come up with two different goals for two different people here?
Sometimes, yeah. And I do this a lot with like, when I take into account my intake into like my parent trainings. Right now, I have a family that I provide biweekly parent trainings to each parent. So I do mom 1 week and then dad the next.
So good.
Just because, like you said, the goals are going to be different and like they might need training differently. And they might have different learning styles and understanding.
See, like, with me, every intake I've ever done, like, it's always one parent. Just because, like, it's the middle of the day, right?
Yeah, so it's, like, getting off work.
Usually, one person's, like, coming in. So sometimes I like to ask, like, how would dad respond? How do you think your, like, partner respond? Stuff of that sort as
Just getting to know. Or, like, how involved, like, are you the primary parent?
Yeah. And then also trying to involve the other like caregiver in the process, even though they're not there. Like, hey, can you start like an email chain with all of us?
Yes.
So I can also communicate with the other person. I feel like this is where like I've made this mistake where I just start like I met mom first, so that me and mom have this really great connection. Yeah. But then me and like the father didn't.
Right. And because you had like you built this rapport during your intake. The other thing that I want to consider during like my family like dynamics section is if the parents are separated.
Yeah.
Have you ever had separated parents?
I actually haven't.
Really?
But I hear some of my coworkers they do. And this is really because I've never been from a home with like separated parents. I've never dealt with it yet. So when it does happen, I want to be ready. So what advice do you have?
So something that I've like come across is like divorced parents in my like when I've been practicing, and it was kind of a tumultuous situation. So it was really, really hard at first. Like, and this is like when I was a new BCBA, so I didn't really know in the intake to kind of ask about that dynamic. So when it came to doing parent trainings with the other parent, we didn't have the rapport as well. So I just had to like create separate chains, like email chains and communication methods. And if I ever changed anything, I wouldn't only tell the one parent.
Yeah.
Like it's really important to like disperse the information to both parents and like share it equally.
Yeah. And then how do you handle like when they're like bad mouthing each other? I feel like that could happen quite often, right?
Does.
Like, you know, like mom like said this and then she told me not to do this, but I do this.
Yeah.
So how do you handle that?
I hear them out. I come from like an empathetic standpoint. I'm like, I hear that. Yeah, I get that. That sounds really, really hard. And like, what do you think is the challenge? Or like, how are you handling it differently? Like, I don't dismiss it, but I just try and like, I hear it, but I don't directly address it.
Okay, that's smart. That's smart. I like that. So, are there any other questions
let's
that we want to jump to?
Yes. Actually, something I wanted to ask you because I kind of had this recently.
Yeah.
Have you ever had a parent where they, it's like almost awkward. Like the rapport isn't there and like you're trying to build rapport and you can't get it. And it's just like asking the interview. So you feel like you're pulling teeth. Like, how do you handle those situations?
I feel like that has happened to me quite a bit. And it's a lot of my parents that come from like different backgrounds. And I think it's just, they don't know everything yet, right? Like, you know, this is a very new, like therapy is a new concept. I have a lot of I had a lot of families that are like new to the country. It's like where I'm kind of going.
Me too.
And that's where I feel like a lot of these pulling teeth questions come from because I think they weren't understanding what I was asking.
The other thing is they might not understand what ABA is.
Yeah.
They just know, we've talked about this in the past, that
and
it's
then
the best,
someone's recommended it to me. So kind of just trying to figure out where I can connect with them on.
Yeah.
Something I've also started doing is like, you know, just not like I'm not oversharing.
Yeah.
But being like, oh, like, you know, that like this is how my weekend was. How's your weekend?
Yeah.
And so that they get to know like I'm a person too. I'm just not this person here to like lecture them, tell them what to do. I don't know where they came from. Sometimes parents come to me and they're like, they've only heard bad things about their kid, you know, like the bads. Like even just telling, like sharing the goods I see.
Let's talk about the wins.
Yeah.
Like, what is your biggest win with your child this week?
Or sharing like things I saw with their kid. Like your kid is so like even in the intake, after the intake, I try to tell them one good thing I saw.
Oh my gosh, during the assessment, can you believe he did this?
Yeah. Or like, he has such good social skills. I'm so impressed.
Yeah, it's such a fun time. Yeah.
Sharing something like that to try to kind of build that connection up with them.
Yeah.
And then sometimes it is a little awkward, but not feeling defeated, like remembering like we have our next time to try to get it together.
Exactly.
Yeah.
So just getting like the information you need and feeling like comfortable moving on and being like, okay. And then knowing like, okay, this family's a little bit trickier to talk to. You have time to prep for your parent trainings and parent meetings.
Yeah.
So let's talk a little bit about questions that we can talk about for like the education section.
So one question I really like to ask is, hey, is your child currently enrolled in school or any other educational programs? And then once I get this question answered, so if say they are in school, I can ask like, how are they adjusting or have they adjusted previously? And then, I mean, adjusting like academically or socially. How's that going for you? Yeah.
Okay. I like that. And I too like to ask like what challenges that they're facing in the school, like if they are enrolled or if they're not enrolled, what are their plans of like when do they want to enroll?
This is a good time to also ask like, how was your last IEP? Because I feel like that's when parents get the most discouraged, right? They learn all this information or sometimes they might have had an IEP that wasn't really like, they didn't know they could ask anything.
I was going to say they might not realize that during the IEP is their time to advocate, but they were just like lectured at the entire time.
So after you hear like, okay, maybe they had a bad experience, like that's okay. Like we'll figure it out together.
Yes,
that's also a great job, like great point to make. Like they can trust you.
Yeah.
And that you're someone that's willing to listen and you're not going to be like, oh, okay, that's just how it is.
You are there to be an advocate, not only for the child, but for the family as well. Like you're there for the parent too.
That's why I love that question. And then also another thing I like to ask is, okay, when we do start therapy, do you plan to do you want to stay in school?
Or what schedule are you looking for?
Is it going to be something after hours?
Yeah.
Because, you know, say you meet the client after and you realize maybe they need a lot more hours.
Yeah.
And you might have to have that conversation because you realized, oh, this is something that's important to them.
Yep.
And then if not, like say they want to come to therapy all the time and you see the client has a lot of skills and they would benefit from staying in school, you might have to have that conversation as well.
Exactly, of like how you're going to balance both therapy and school and like what that's going to look like.
Or even like do they have, sometimes I'll learn like, oh, we don't have transportation in the middle of the day.
And that's always really tricky.
Yeah.
I've experienced that more times than I can count. Like
this is usually when I'll also ask like, I totally forgot to mention it in the family day.
Yeah.
Like, what do you guys do?
Right.
Like, what does work look like for you guys?
Yes, going back, that is one of the most important questions. One, for establishing rapport, showing your interest in them, but it also like plays into how they're going to be able to parent their child.
Like, can they like pick up and drop off? What is that going to look like?
Is your work flexible?
Yeah. And then if they have really like demanding jobs, who's going to drop them off? Stuff of that sort. And then if they're working from home, is there like any barriers to that with their kiddo at home? Yeah. I mean, it's already hard. Like
they already have their own barriers. Yeah.
But stuff of that sort, knowing that stuff is really, really helpful.
I agree too. Like going back to education, another question that I really like to ask is, are there any particular supports or services provided at school that you feel have been helpful? So if they have had an IEP, are they receiving speech or OT like through the school? And like are they finding beneficial from it?
Or have they heard back from any of them at all?
Yeah.
And usually you learn like they have AAC devices given to them by like the speech paths like here as well.
Exactly. Yeah. So I think that's really, really important to address them too.
And then also back to that, like, are you using the tools that they have given you, or is it something you just have?
Or, is the school, like, are they providing the parents education on how to use them?
Right.
Because they might be giving the student an AAC device, but do the parents know how to use it or train with it?
Yeah. Sometimes I'll hear, like, we have it. It just stays in the backpack, goes back and forth. So that's something you can know, like, okay, like, let's go back to that. Let's figure out what the speech path wants at school. Because, I mean, they don't always have time to.
No, they don't. Yeah, they're busy.
And then if they're going to receive other services where you are mentioning that to the next person as well.
Yep, exactly. And ensuring that they have a line of communication starting with us.
Are there any other goals related to school you feel like you would want to ask?
I think with education, I keep it, like, with just those and keep it fairly, like, broad and open-ended with those two questions.
Okay. And then one more thing. I just thought of it.
Okay.
Is like, okay, how are they able to, if they are going to school, are they eating at school?
Oh.
When is like lunchtime?
Okay.
Will they be eating when they get here?
Yeah.
Stuff of that sort. How does toileting look like at school?
Yeah.
Stuff of that sort as
like
well.
Those kind of things too.
To kind of figure, like, especially if they're going to school, it's probably going to like translate here.
Right.
But if they aren't, that might be something you need to focus on too.
To address, and target within your goals.
All right, so let's kind of go into some other just questions that we think are really important to ask.
Yes.
So what are some of your goals for your child in both the short term and the long term? So say short term, you want to give an example? Yeah.
Yes. So short term, like what are they looking for, like to reduce behaviors? Is there any like specific communication goal that they're looking to like increase as far as short term goes? As far as long term, I think this goes like,
and this is a hard question
rug.
to answer.
Yeah.
Because you're like, what do you mean long term?
And it's like, honestly, do they even know, or have they had a chance to think about it? So like help them brainstorm like, okay, in like the next 10 to 15 years, what do you have hopes for your child? What are your goals for your child?
That's really good. And guiding them is really important. Like, so I feel like if someone asked me that, I'd be like, sometimes even now, like if a doctor asked me that, I'd be like, I don't know. I want her to crawl.
I want her to crawl. I want her to be able to move around. Like honestly,
but then like guiding. Okay, like that's a good start. So from going forward, what does that look like in 10 years?
Yeah,
it's really
exactly.
Good. And then any other questions that are coming to your mind?
Yes, I like to ask, how do you envision their progress through ABA therapy? So this kind of goes back to like in hopes that they understand what ABA therapy is. But if they do, like we want to know what they're hoping to get out of it, because they're spending a lot of money to be in ABA therapy. Like insurance covers it, but it's still a lot about a
you
pocket.
have to hit your deductible. I've had parents actually around when I asked them this, like they've mentioned like we were researching ABA and we've read a lot about like that it's not the most beneficial. Like so I've also had to like address that in like these meetings. So I feel like that's also something to be ready to that you should be ready to answer.
Yes, be ready to answer and like understand how the services you're providing are neuroaffirming.
Yeah.
You know.
And then if you're not able to answer that in that moment, I feel like they could go away, like not feeling the best about it.
Not feeling like trustworthy of the services you're providing.
So make sure
understand our history.
Yeah, understand our history. Make sure you're ready to talk about it.
Yes.
So other questions I like to ask are like, what specific skills or behaviors would you like us to focus on during therapy sessions? Like as we start.
Yeah.
So, you know, sometimes you get like some of the things that you may not be able to do. Oh, I want them to learn to read.
I want them, to be able to answer their like math questions.
Yeah. Be like, okay, like I see that's an important goal for you. That's not something we really can work on in ABA, but some prerequisites to that we could probably do are XYZ. Or is this something that your like child is struggling with?
Yes, and explaining to them why we can't target it as like a core deficit of autism. And then like following up with like the particular challenges, I think that sometimes when parents come in, they are seeking services because they need help. So there are a lot of challenges that they're facing. So help them identify like what the biggest challenges for them are at that moment, because we don't want them to think that they're going to come into ABA therapy and we're going to fix all of their problems overnight.
No. And then also reminding them like, okay, like this might not reminding them, but telling them, okay, like these are goals we're going to put in.
Yeah.
And then we're going to look back at it in a few months.
Yes.
Telling them even like at 6 months, we're going to do another reassessment.
Yes.
And then we'll look back at all of these goals.
Rather than them being like, okay, it's been 2 weeks. What's going on? How's toileting coming? How's this? You know?
Right. Those are good ones.
I think so.
Do you feel like there's any other questions that you would ask or that you would follow up with once you've gotten through all of this?
I think once we go through everything, there are a few follow-up questions that you do want to ask, such as like, could you give us an example of like specific situations where your child's behavior was particularly challenging? We want to do these kind of questions to get scenarios. Like if we were discussing in the behavior section, say that they're like, oh no, they don't have any behaviors. So when we ask like these follow-up questions, we're getting to know like the specific scenarios that are happening.
Right.
If that makes
sense. And then I think like even if you've already asked, like I know we asked this before, but maybe by now they're feeling a little more comfortable with you because you've had a little bit more of this back and forth where they're like, oh yeah, by the way.
Like, oh, that makes sense now that we've kind of talked about it. Yeah.
Like this is what I have to share.
Yeah,
Another one is also the looking back, how effective did you find like the previous strategies? Like especially if they've been anywhere else, like another center, like what strategies have they used with your like client? Like did they have a behavior intervention plan? Did you get to read that?
Yeah.
Even asking like if they've been at another therapy center, like have you gotten to read like the previous goals? Because I've had so many families tell me they don't know what was written in the report. They had no idea what their child was working on in therapy. Being like, oh, like telling them like, okay, like that wasn't the best, but going forward we are going to talk about these things.
It's really important that we talk about them regularly. And I think too, like with the follow-up, like kind of when we're going through these different like follow-up questions and situations. Oh my God, hold on. I don't even know where my brain was going.
No, okay, so you're talking about, you are thinking about like these follow-up questions.
Yeah.
And we kind of just went back to them, right? Like these are questions we've already asked them, but now we're jumping back.
Yeah. So like what, and feel free to like, if you think of things like about those situations, like if they kind of gave you bits and pieces at the beginning, like kind of short answers. And now you've realized, like Yousra was saying, like that they have this rapport. Asking some of those questions again, being like, oh, wait, okay. I thought about this. Like, how about in this situation? How is that occurring?
Right. That's really good. And I think just feeling confident is like the most like important thing here. I know it can be scary, especially if you're new. It can be scary. I mean, it's scary for the parent, like caregiver as well. They're meeting you for the first time.
And so, like one of the biggest things of advice that I got when I was, because as a student, I had to practice intakes. That was one of my like main assignments. My BCBA told me, and I use it like honestly to this day, is fake it till you make it. Like the parent doesn't know that you're nervous. You are the professional, so have confidence in your professional like understanding of these concepts.
You got this.
Yeah.
That's great advice. So we kind of had one of our code words to go for.
Yes.
Before we go to the next topic. Sorry.
That's okay.
We always forget.
Our code word for like the code word number 2 is intake.
Okay. So some other tips that we have are, we talked about this before too, but remember, you know, we're asking a lot of these open-ended questions, but it doesn't hurt to have a structured interview template.
Right.
Create one for yourself. Go like ask your colleagues what works for them, what questions they ask, and start a list. It's very important for you.
And even if you don't intend to ask every single question that we've like provided you as samples, this is just your like bank to have, like if the conversation's not flowing.
Because we want to make sure we have all the necessary information before we write any of these goals.
Yes.
Right.
Yeah.
And then another, you like this one the most.
Yeah. Something else that like I would recommend is just having like some parent information handouts, like kind of going back to the parent might not know what ABA is. So like have like a little handout explaining ABA. We do this, like we use Canva and we create like cute little fonts using our like
and we'll even
colors.
send the about me. Yeah. Share our about me. Like this is stuff like, this is who I am. These are some of my hobbies. Just to make us little more personal.
And on that about me, we have like a little picture of us. So sometimes like our intake coordinator will send this ahead of time so that they have a chance to get familiar with us before.
And usually within this is also like this is how you can reach me. This is what you should expect, like, first therapy session to look like, stuff of that sort.
Yeah. And yeah, it just like eases their anxiety too, because again, they're coming into this like new, sometimes they haven't had other services before. So they're coming into this big new environment with like a little bit more of expectations now.
These are great. Before we jump into kind of what to do next with this information, I just wanted to kind of talk about like, now you're like, after this intake question, after you've done all your intake questions, this is where you're probably going to be like, hey, like, I'm going to take the learner and we're going to go do the we're going to go do the assessment.
Sure.
Try to remember, like, did they tell you they wanted to stay? Did they tell you they're okay with leaving?
Yeah.
And if they weren't okay with leaving, like, okay, like we're going to go back to the center, kind of like prepping them for that.
How do you go about it if the parent wants to join the assessment and like say that they want to help the child out a little bit?
I say, sure, like, come on back.
Okay.
And then if you feel comfortable, you're, like, I'm happy, like, to see you go. Like, you can step out, like, using X, Y, Z. I try to tell them where the exits are.
Yeah.
Like, if you feel comfortable,
whenever you're
you
ready.
can leave.
Yeah.
But if you want to stay, I totally get it. I might ask you for some help, like, with running some of the programs if you're comfortable. If not, I'm going to run them. Just remember that, you know, sometimes with, like, a caregiver there or parent there, that sometimes we see like different skills. Like they may be able to, they may respond differently. Trying to remind them of that.
Yeah.
And I kind of just let, like, whatever happens, I kind of talk them through it. Like, I'm going to do this. We're gonna see how I kind of talk them through what's happening.
Yeah. Just letting them know, because again, they don't know why you're asking their child all these questions.
It's like, I might also say, like, this is going to seem like a lot. I'm going to be asking them a lot of questions. Yeah. But, you know, if you feel like it's too much, let me know.
Yeah. If you're ever uncomfortable, let us know.
Yeah. Stuff of that sort. And then I've had most of the time when parents come back, they end up like seeing like, okay, like my kid's fine. Okay, I'm gonna leave now.
Yeah, they're like, oh, it looks like all these other kids are having fun, and they're
and then if they tell me they're gonna leave, and we know, like, they've told me, like, my child has a hard time when I leave.
The separation,
yeah. So we come up with a little plan right there and then. So I usually say, like, if you're comfortable, like, are you okay with just leaving?
Yeah.
You know, and then
your child might cry. I'm here to support them.
And after we've talked about it, I think they feel a little more comfortable.
Yeah.
Just like, okay, like, I know they're crying, but I'm going to leave. Yeah. Versus when I didn't ask.
Oh my gosh,
you know, because I've seen that, like, where I was just like, okay, let's go. And then they get
like doe eyes. They're like, wait, I have to come back. Yeah. And then they like return into the room.
And then we were like in this midst of like this back and forth. Yeah. And, you know, this is the first time you're meeting this learner too. You want them to have a good experience. Yeah. So you're stuck. So just like ask.
Prep the family.
Prep the family. Be ready to do what you need to do.
Yeah, agreed.
So, okay, now we have all of this information. What should we do?
What are we doing next?
Okay, so we need to look at, like, the key themes and, like, concerns. Like, they mentioned a few times in the interview that they were struggling with communication. Yeah. So I know I need to write a communication goal for them. Mm-hmm. And then I heard them say that every time they try to, like, help them communicate, a problem behavior occurs. So I like, okay, I need to write a goal for parents here.
Yeah. So this is where you're deciding like forming the goals of not only the child, but for the parent too. Okay.
Mm-hmm. Is there something you like to look at when you're doing, like, looking back at your intake questions?
Yeah. I really start to look at where I'm going to prioritize my therapy goals. What are the main needs of this learner?
Mm-hmm. And also what the family really wants to, right?
Yeah. Like what's most critical to them? What's socially significant to the family? Right. If that makes sense. Like if it's most important to me, that means nothing.
Yeah.
How is it going to help
Exactly.
them?
What's something that they really want to see from their learner?
Yeah.
Because we can't write every goal in the book either. I could probably have a lot more.
Yeah. We don't need to. Like, we don't just fill to fill. We want things to be meaningful. And you want to focus on the areas that are going to have the biggest and greatest impact on the child's, like, life, like the progress for the learner and the family's well-being.
So, and then going forward, we also want to set, like, we're going to go into this a little deeper, but we feel like, me and Kirsten, but we really feel like writing parent training goals is probably, like, the hardest.
That was the biggest area I struggled in, and I think I have done like 4 CEUs on it, and it's just
it's still really hard.
It's still
really hard when you're sitting and thinking about it, and I also feel like it's the part that insurance companies always come back to and ask about. Yes. But it's also the most generic thing I see everywhere. It's always the same goals.
It's the same, like focusing on like learning the 4 functions. We'll identify an intervention strategy, like,
and that's really what we were kind of getting. Like, we want to ask these questions to help drive you to write really meaningful goals.
We want specific, individualized, very like client-centered family goals.
Yep. So we're going to kind of give you some examples.
Yes.
We went through. Okay. So we talked about the developmental history.
Yep.
So say the information you gathered was that parents are concerned about delayed speech development. Okay. So I've identified that they need support in promoting language development.
Sure.
So I know a goal for the parents is to increase the parents' understanding of language developmental strategies.
Yep.
So the specific goal I'm going to write in the scenario is parents will target requesting with their child for 15 minutes daily during playtime 5 days a week over the course of 2 months.
Okay, perfect. I really like that one, it's not like crazy expectations that they're going to be targeting it all day long. You're setting aside 15 minutes, one like per day, and then you're looking at it over 2 months rather than like a short period of time. I like that measurement criteria.
And I feel like it's a lot easier to measure on yourself because that's something I struggled with in the beginning too. Like I had all of these like goals written. Like I've been guilty of the like, we'll identify for like, how do you?
100%.
And it's written like with 80, like it's written with the 80% accuracy across 3. Like I'm like, but how? Like,
am I quizzing the family? What is this looking like?
How will I do that? I feel like this is really easy for me to like figure out.
And before we jump to like the other areas, I kind of want to talk a little bit about like how are you keeping track of these goals? So what I do is, so I like set this goal. I have this very specific goal. It's really meaningful. It's something that I know the family wants to work on. Please be checking in on it during your, like we do weekly parent meetings. So in my weekly parent meeting, the first thing I do is, okay, so how is communication going? Are you finding time to do this? Because then you can address the barriers. What prompts does the family need for your goal?
And then I know we talked about this last episode too, where like a lot of like parent training, it ends up being like sometimes if you don't have time to prep and you don't have these strategies ready, you just start talking about like the crisis of the week. So it is very important to check back because it might be needed. You might need to talk about what's happened
100%, yeah.
But don't forget about the goals that you wrote.
Even if it's a brief check-in. Yeah, it's really, it's just important to keep up with. And even if it's like on a biweekly basis, just keep in mind your mastery criteria and if you're monitoring the parents' mastery.
Awesome. All right, so the next one we're going to talk about is current behaviors and concerns, right?
So with current behaviors and concerns, we said that like, okay, say this child exhibits frequent tantrums, especially during transitions. We learned this during the intake interview. So during that, I identified that the child needs strategies to manage and reduce tantrums. So the goal for parents that I like am kind of addressing is equip parents with effective barrier management strategies. So the specific goal I'm going to write in the treatment plan is caregiver will participate in 2 observation parent trainings per month to practice modeled antecedent and reactive strategies for targeted behaviors over a 6-month period.
I love this one.
Because
you have a really good way to see it.
Yes.
You're going to be observing them.
Yeah.
I love, because I feel like this is where we want to teach them these strategies that are going to benefit them. So that's where we start with like, we'll identify 4 functions, X, Y, Z. Want to teach them that. They don't need to know all this.
No.
They need to be able to know how to respond in these situations and how they can help.
And having a hands-on approach is the best way to do that. I can lecture them and tell them in our meetings so many times. I can give them handouts explaining how to handle a behavior. But the only way that they're going to really know how to do it is having it modeled and practicing.
Exactly.
Like we do BST. Exactly. All day. Do it with your parents too.
And then the goal will hold you account. I feel like this goal can hold you accountable to like, this has happened. And you can score it. Or you can report back to like when you need to insurance companies or when you're doing their reassessment, like, okay, this is where they're at right now.
Yeah, they've been able to attend once a week. Yeah. So we're getting towards like 2 times a week or 2 times a month.
2 observations. All right, next one is kind of with the family dynamics. Some of the information I gathered there was the family needs structure with the multiple caregivers and the inconsistent routines that are being implemented. Because they've got grandma in there, they've got grandpa, siblings are accidentally like...
They got like an older sibling who's trying to help
as well. So I identified that a need is that they need to establish a consistent routine for their child.
Sure.
So the goal I want to really create is I want to create and maintain a structured daily routine for the client.
Okay.
So the specific goal that I'm going to write is caregivers will utilize a visual schedule paired with visual cues provided by the BCBA to create a consistent routine for daily routines and activities.
Okay, I like this. And I like that you're having like the visual schedule for them and that you are providing it to them. Yeah. You're not expecting the parent to like create their own like visual schedules. You're setting it up for them to set them up for success.
And that way I can help train them on it. And then I know like, okay, maybe in the future, I know they're not going to have me. I can help them create them for them to be the ones that create this later on.
Exactly.
But just not right now.
No,
It's just
when
we're
they're
gonna
starting
start-
out.
yeah.
This is after the intake.
Yep.
They have no experience with us.
And then next one's for you, right?
Yes. So our next section that our goal will relate to is the education and background section. So during the intake, I gathered that the child struggles with social interactions at school. So I identified that the child needs to, a need for the child is they struggle with social interactions. So my goal for the parent is enhancing child's social skills through guided interactions. So what I'm going to write with my assessment treatment plan is parents will practice turn-taking games and role-playing social scenarios with their child twice a week to improve social skills and interaction.
I feel like this is also a really easy one for the parents to do.
Exactly.
Because you can guide them with like, okay, these are some games you can play.
Yep.
These are some like situations or some interactions you can start doing with the client.
Yep.
And then it's easy to measure as well.
It's 2 times a week.
Yep.
So it's not like, again, you're not asking them to play with them all day, every day. Like it's setting aside designated time to really target it.
And say this is a family that you learned like got 2 surgeon parents.
Yeah.
And they don't have as much time as everyone else, or
Yeah.
they have this client also like maybe they go to like swim after therapy, like
Right.
they're only coming home and like really eating and going to bed.
Exactly. So you're giving them the time to like work on this.
Yeah. So next code word, right?
Yes, our code word number 3 today is goals. That'll be your final code word for this episode.
And then our last example was kind of like when we were just asking parents about their long-term goals.
Yeah.
So I've gathered, parents have long-term goals for independence and daily skills. And then I've identified a need. They want to learn how to do the stuff at home, how to teach daily living skills to their kiddo.
Yeah.
And then I know the goal I need to write needs to support the development of self-care and independence for that
Sure.
family. So the specific goal I have is parents will teach their child basic self-care tasks such as brushing teeth and getting dressed independently by the end of the month. This is something you could also break up if you needed to.
If the child is really going to take a while, like
Yeah.
if you guys have been working on teeth brushing for like months, know that like we should probably target that one at a time. But if you know that the learner is pretty quick to learn, you know that the parent's involved and they're practicing the same strategies, you can combine them.
Yeah. That's really all I had for like all of our examples and goals. I kind of had to start, like, how do you feel after doing this? You feel like giving everyone all the information they needed?
Yeah, I feel like we provided a lot of information and it feels like almost overwhelming. Like we gave them so much. So,
but at the same time, I feel like we didn't like go over everything. There's so many
Yes.
other questions you could be asking.
there's so much. So take what you need from this. Like again, don't regurgitate what we're doing. Exactly. Like fit it to your model. Like yourself best and you know how your assessments and your intakes are already going.
Yeah.
So just take some of these things like with the questions that we're asking.
And we also recognize we're not perfect. We may have missed some questions.
We are
or
still
some things.
learning.
Yeah. So if you guys have any for us, let us know. We would love to share them with everyone else too.
Yeah.
And we'll see you guys next time.
See you soon. All right, guys. Thank you so much for listening. Please don't forget to like and subscribe. And if you want your CEU credits, go to our website at blossomchildrencenter.com.
Talk to you later.
See you.